My name is Dr. Tara Winters. I'm a physical therapist here at Anderson Sport and Wellness. Today I'm going to be demonstrating the vibration map for releasing the low back. If you have any type of spinal fusion, please don't perform this map. Today we're going to be using the Purewave vibration tool for all of our different areas. We're going to start at the feet. So with the feet, we want to be using this head. So how to do that is you're going to turn on and wait for it to beep for a second time, and then you'll start to turn it up. So this vibration is at a higher frequency. Now when we're releasing the feet, you can either be in standing or lying down. Either way, it's going to put more pressure and increase the vibration through the body. So I'll demonstrate lying down. We're going to be using the melt foot map. So we have that if you need to review, but I'll go through each area as we go. So we're going to start with position point 1, which on the foot is right in the middle of the arch here. So with that, you're going to be lying down and resting the foot over that area. It doesn't have to be right on the pointed head of the handle end of the Purewave, but you're just resting over it, holding here for 2 breaths. And then we're going to move up to position points 2, which is at the metatarsal heads. So that's on the pads of your foot here. And we'll go through each one for each toe. Again, just holding for 2 breaths. Once you get through all of the toes, you'll move down to position point 3A. So position point 3 has 2 areas. And it's the fascial attachments of the plantar fascia. So one at the top, close to the metatarsal heads, and then one lower. So again, holding there for 2 breaths. And then moving down to 3B. And then for position point 4, it's going to be on the outside of the foot. Holding there. And then the last one for the foot is going to be right at the top of the heel. And that's position point 5, so holding here. Now once you've gone through all of those, again, you can perform this laying down or standing. We'll move to the calves. So for the calves, we will turn it off, turn it back on to utilize this head. So here I'm using the round head. We can use that for more general relaxation, as well as this flat head here. This one's going to be a little more intense. And then if you use the more pointed head, that one's going to be a little more aggressive, and sometimes that can cause the nervous system to ramp up and the tissue actually might be tighter. So it's more beneficial to use these heads for that deeper penetration, but more broad. So for the calves, you can just lie down and rest the calf on the vibrating head here. So you're looking for any trigger points or tender areas. If you find one, you can stay there, and you want to stay there for only 30 seconds to 1 minute. If you go too long, there's a point of diminishing return with vibration to where you're not going to benefit from it anymore, and the tissue can actually, again, tighten up. So you can do it like this, laying on your back anywhere in the calf, or you can perform it on your side. And now it's just resting against me, laying on my side. Now, we're going to move up to the adductors. So those are your inner thigh muscles. We want to start at the attachment sites for these muscles. So that's going to be right here, down here at the knee, and then up in the groin. So it's on the inside of the leg. And again, you can just be resting it there, or you can use your arm to hold it in place. And just about 30 seconds to a minute here. And then moving up to the more proximal attachment and resting here for 30 seconds to a minute. Our next area is the quad, so that's the muscle on the front of your leg here. Trigger points can tend to be in the outside of the quad. We don't want to go all the way on the outside into the IT band, but right where that quad muscle, and you're still feeling that muscle tissue. Those can be some tender areas. or you can go generally in the middle of the muscle to release. And again, just 30 seconds to a minute. The next area is your TFL. So that's going to be up kind of where your pant pocket would be. It's one of our hip flexor muscles. So right in there. Trigger points from here can refer down the outside of the leg. So again, just right where your pant pocket is. Looking for any tender areas here. If you do find trigger points in this muscle, or any of these muscles in the upper leg, you can turn the machine off and then turn it back on and utilize this head. So the more pointed head, it's designed more so for trigger points, and then just holding it over that tender area, again, just 30 seconds here. And you'll get an effective release here. Next, we move on to the glutes. So glute med and min are gonna be on the side of your hip. So a little more toward the back of your body, away from kind of that pocket area. And again, we're just holding it here, looking for any trigger points, but still just spending 30 seconds to a minute on that area. And then moving a little bit more toward the back of your body for glute med. Any of these muscles being tight or having trigger points can mimic sciatica, or that pain down the leg. It can also create, contribute to your back pain. So it's important to release these. And then our final area that we're going to release is our QL. So QL is the muscle in our back. It runs from the top of your pelvis, so your hip bone, and up into your lumbar spine and your ribs. So again, we want to target the attachment sites first. So that would be right below the ribs, not on the ribs, right below, where you'll feel kind of that tight muscle there. And then right above your iliac crest, or this bone here. You can always look up these muscles online too to kind of understand the anatomy a little bit more and where you should be targeting. So with this one, you can be on your side. And again, I'm a little bit higher up toward the ribs. The more you can let the tool relax and not use your hand to control it, it'll be easier on your body because now your tissues aren't having to work. So just resting it there, again, 30 seconds to a minute at the attachment site, and then moving down to that distal attachment site right above the hip, and holding there. Just to reiterate, again, using this head if you're finding any trigger points, and then spending about 30 seconds on that area. If a muscle releases or a trigger point releases, you might feel a little jolt, a little shock. That's completely normal.